Alright, so we have our dear friend and the patient, Rafi here. Rafi comes in with a problem with left-sided radiculopathy originating from L5-S1 nerve root. Now I just did my motor testing on him and I found that his S1 gastric soleus response is pretty weak. The pain is consistent with the nerve root levels. He has developed some weakness and the pain has been exacerbated. He's having difficulties walking, bending down, bending forward, most importantly. So we tried several conservative methods throughout this particular course of treatment. He's been through several physical therapists. We tried anything from spinal manipulation to flexion distraction techniques. All of these things do tend to help, but they are only a temporary source of relief. Now Rafi is looking for more of a permanent source of relief, so he is considering to get an epidural shot, right?
Cortisol.
Well, that's an epidural shot.
Oh, great. Okay.
Right, so he's strongly considering that. We are going to try something which I invented a long time ago, which is called Axial Spinal Decompression. We will isolate the L5-S1 level during the process and see if we're able to centralize his radicular pain from the left leg. All right? So you okay with this? You give us permission to torture you?
Yes.
Very good. Alright, so we're putting on this corset on him, making sure that it's nice and tight because otherwise he's going to fly off the table. I don't want that happening today. Is this tight?
Yeah.
Now you know what women feel like. Very good. You know, in the 1800s, this is all they would wear. A girl has a little belly, squeeze it in. Alright, we're ready?
Yep.
So Rafi, all you have to do is relax. It's going to feel like you're flying over the table. You're not. You're going to feel like you're getting taller. You let us know. How tall are you now?
5'9".
Alright, so we'll try to make you into 6'1" by the time we're done with this. So we're going to go one level above. Since he's L5-S1, I'm going to actually stabilize by L4 to make him more comfortable. And by the way, he does have a problem there. He has a bulging disc at L4 without any really neural compression. But either way, this is a good point of stabilization. Go ahead. Let's give it a little trial traction. Rafi, do you feel anything?
Of course.
What do you feel?
Pressure.
Pressure. Can we go a little more?
Yeah.
By the way, at any point, you're more than welcome to tell me that this is hurting and I will have to change the positioning of my hands. Alright?
Okay.
Alright, let's go a little more. So we've distracted approximately about 50% of his body weight, which I will not reveal for cosmetic purposes. I know the back feels like it's getting stretched right now. What about the leg?
No.
What do you feel in the leg right now?
Don't do anything.
There's no pain radiating into the leg?
No.
That's how you know that we actually opened up that particular intervertebral foramen and got the pressure off the nerve root kind of temporary.
Oh. No, I just feel the pain in my back.
Is it tolerable?
Yes.
Good. He's a real trooper. Don't worry, epidural shot feels 10 times better than this.
Oh, man. Okay.
And let's give him a little break. Slowly, let's come off the traction. We're going to do it one more time. Let us know when you're ready. So this is much more of an intense and also more of a specific technique which we use in the clinic. Now conventional traction units, they're pretty much distracting the whole lumbar spine without isolating a specific segment. Unlike with McManus' approach, we're able to isolate, let's say in his case L5-S1 into flexion and then distraction, but in this particular method we're just going out axially and we're able to isolate 2 or 3 segments at a time, which is much more specific. Okay, good. Now
Yeah.
let's bring him back.
Yep.
Rafi, go ahead. Slowly move to your side.
Which side?
Let's go on the right side. Let's go on your good side. And face me. I'm gonna help you out. Bring the tush a little towards me. Give me your hand. Let me set you up. Ready? 1, 2, 3, go. Alright, and stand up. How does the leg feel right now? Feels better? There's no pain? Isolated pain in the back. If you come in tomorrow and you tell me my back is killing me, but I no longer have the symptoms in my leg, I'll be the happiest person. That's when I shake your hand, we'll go out for beer. That's it.
Sounds good.
No, that's right.
Try to stand up on your toes. Yeah?
Yeah.
No pain at all?
No.
Perfect. So this, I would consider this a very successful treatment in our spine lab here at Back to Health Physical Therapy. Thank you.